introductions. And Tyler, maybe you could start us off.
Sure. Hi, good afternoon, everyone. Tyler Slattery. I use he, him pronouns, and I'm a senior program coordinator with our communicable disease team here at Washington County. Good to see you all. I'll
Great,
pass it to Jonathan.
thanks. Great.
Hello, my name is Jonathan Gertson. I'm one of the epidemiologists on the CD team. I'll pass it along to Jenny.
Hi, I'm Jenny or Jennifer Robertson. I answer to both, and I'm one of the CD nurses.
Sunhei, you want to go?
Hi, this is Honghae Boko. I'm one of the CD nurse at Washington County. Pass to Sue.
Hi, Sue Leong here with Washington County, one of the CD nurse. Thank you.
Great. And Callie?
Everyone, I'm Callie with Infection Prevention Access to Care Branch Supervisor. Nice to see you all.
Thanks. And I'm Bridget Matarasi, and I'm with the Infection Prevention and Access to Care program as well. So we're happy to have you. I wanted to just pull up the agenda really quick, share with you what we're going to be covering today. Here we go. So we're going to start with a discussion of the line list. Jonathan's going to take us through that. He'll also give us some data update on outbreak data and what we've been seeing at the county. And then after that, Tyler will talk to us a little bit about the changes in the reporting thresholds. And then Jonathan will give a presentation on enterics, and then we'll wrap up. Okay, I'm going to stop sharing, and Jonathan, I'll pass it over to you. Oh, Callie,
Can I ask a question real quick before we start? Are you recording this?
Yeah.
Okay, thank you.
Thanks. I think it says recording. Did you notice a recording at the top of the page?
Yes.
Yeah. Thanks.
I didn't, but that doesn't mean much.
Okay. Okay. Thank you.
Well, thank you for joining us today. Just going to briefly touch on the line list that folks have been using at long-term care facilities. You may receive these, or you'll typically receive these from our public health nurses when you call in and report case, possible outbreak, and we want to collect some additional details. What I'm sharing right now is a respiratory log with example data. No personal information is going to be shared today. We would typically expect you to fill out all these columns to the best of your ability, and we also have a spreadsheet that is very similar for GI, a cluster or outbreak of GI cases that we're wanting to follow up on. What we did recently with the school nurses, and we received feedback from them in regards to updating these line lists, and I'll share an example of the school line list so you can get an idea of how it changed. We tried to simplify the line list, so we're getting down to the fields that are required, but we're also considering what fields are possible for you to collect, given everything that's going on at your facilities. So I just want to check. Sorry, the line list that we usually share with you, and what whether there's a need. So the folks who were able to join us today, if you're comfortable either commenting in the chat or coming off of mute to give us an idea of what your experience has been with these line lists, that'd be super helpful in us figuring out if we need to take some time to update them. And no worries if there's no comment here. This is something that we can have an ongoing conversation.
While folks are thinking about that too, I have a poll, so maybe giving folks some time to kind of think about that. We could launch the poll in the meantime. Does that work? Okay.
Yeah, great idea. Thank you.
Okay. And this is an anonymous poll, so it kind of indicates that there's no names associated. Okay. Welcome. Yeah, we have a poll in the chat. And then, Jonathan, you want to refer to your line list here if there's any feedback?
Yeah, thanks for joining us, Stephanie. We're currently taking a minute to just discuss the line lists that you folks will receive from usually our public health nurses when we're investigating whether there is an outbreak or we know there's an outbreak that we want to follow up on. And we want to reserve a little bit of space here to discuss whether we want to make any updates to the line list, what's been working well, what could be improved, any thoughts you have in regards to the line list, or if we should be working on it, would be very helpful. And Bridget also launched a poll, so we'll take a minute to work through the poll and give people time to think through what's been helpful, what's been challenging in regards to the line list.
Yeah, and you're welcome to put any comments in the chat or come off of mute. Jonathan, did you want to move on to data?
Yeah, that sounds like a great idea. I'm going to stop sharing while I get that lined up.
While you're transitioning, I'll just put it out to folks. After the meeting, we will share, we'll send out an email, a follow-up email, and we'll have our contact information. So if folks are watching this as a recording afterwards, or maybe just need some time to digest and kind of think about some feedback, you're welcome to reach out at any point to kind of share your thoughts about ways that we might improve our line list. Thank you.
Thank you, Tyler. Yeah. Awesome. So we are going to transition into a little bit of a data summary, and then later on in the meeting, I'll also chat a bit about enterics. Let's see if this will cooperate. Apologies. There we go. So looking at just long-term care facility data in 2024 in Washington County, you folks had to respond to 114 total outbreaks that we knew the etiology for. And we have those diagrammed on this image, where the vast majority are that green COVID-19 at 102. We also saw influenza, norovirus, parainfluenza, RSV, and outbreaks that involved multiple pathogens at the same time. So far for 2025, we're up to 25 total outbreaks. Most of them are still influenza, but a bit more balanced than 2024, at least so far, with 7 influenza outbreaks and 4 norovirus. Looking back over the years, last year was definitely one of the heavier years in terms of outbreaks. 2023 has been our current record, our current peak was set in 2023. Hopefully in 2025, we can continue a downward trend, but if it even stays steady, we're in for a busy year. We see that most of the outbreaks we are responding to are respiratory, the vast majority, ever since the onset of introduction or entry of COVID. Wastewater is one of our best ways to kind of detect and keep track of COVID-19 activity, especially since testing has become more sparse. In Oregon, we see that currently we have a pretty low activity, but we're kind of surrounded by states with a bit higher activity. Looking at COVID-19 test positivity in Oregon, looking at that orange line is that current season that we're in, 2024 to 2025, and it's been a bit more mild season in terms of test positivity than the years prior. In terms of hospitalization, we're also seeing less severe peaks. Going back to 2023, that was a rough period of time, but we have seen peaks going back in July of 2024 and that winter of 2024. The group that's most impacted is that red line, the folks who are 65 years and older, followed by folks who are 50 to 64 years old. Influenza A, we also have wastewater, and similar trend to COVID-19, lower activity in Oregon, but we're surrounded by states with a bit higher activity. Looking at test positivity in Oregon, that orange line again is that current season. For influenza, it's been a bit more active than last year, and we've seen a kind of a second peak, if you will, after the first peak in December. And in terms of hospitalizations, again, the most impacted are going to be the folks who are 65 years and older, followed by folks who are 50 to 64 years old. And that black line is the overall, so the average of overall all of them. And we're looking at the rate, so number of individuals impacted or hospitalized per 100,000. And just to give a context for years prior, in 2022, 2023 season, we were at a rate of 187 hospitalizations for every 100,000 individuals who are 65 years or older. Whereas in this year, we're at 298. So 187 to 298 in terms of rate. Very drastic increase, very unfortunate to see that many people needing to be hospitalized as a result of influenza this season. Fortunately, over the last couple of weeks, we've seen that decrease in the most impacted age group. Hopefully that trend continues. And for influenza A, we also have my apologies with the title slide. This is RSV. We also have wastewater data on RSV, similar to influenza and COVID-19. Bit lower wastewater activity surrounded by states that are a bit more active. In terms of test positivity, we're seeing a kind of stabilizing, still pretty moderate activity, a bit later season this year in 24-25 compared to last year's. In terms of RSV-associated hospitalizations, we're seeing a lot of folks, the most impacted population being 0 to 4-year-olds, the littlest of the kiddos, followed by folks who are 65 years and older. And recently looking at, in terms of emergency department visits, we've fortunately been a bit less active in terms of COVID-19 on the far left, but we have seen a lot of activity in terms of influenza. Fortunately, it's decreased recently. Hopefully it continues. And RSV season, too early to tell if we're going to continue to see activity at this level or if we're going to see an increase or decrease. And I'll stop for now and pass it back to Tyler. But before I do, any questions or comments from folks on the data? All right, Tyler, please take it away.
All right, thank you, Jonathan. Jonathan, thanks for sharing that. Hopping on here just real briefly to share a couple of updates regarding outbreak reporting thresholds for long-term care facilities. I'm going to share my screen real quick. So this is a document that we kind of maintain and send out to facilities and update periodically as updates occur. So this may look pretty familiar, and we will send out the updated copy of this following the meeting today. So the main update that I wanted to share today is in this second bullet point regarding respiratory illnesses. So earlier this year, OHA did update the reporting threshold for respiratory illnesses, so COVID, flu, RSV. As you're probably all aware, previously an outbreak was considered 2 or more cases within a 7-day period. And with this update, there's a couple criteria to be met, so it's a little bit wordy here, but an outbreak of respiratory illnesses should be reported to us when there are 3 or more confirmed or presumptive cases, again, of RSV, influenza, or COVID, affecting at least equal to or greater than 10% of staff or residents in a 7-day period in the same cohort. So as an example, if there's a memory care unit with about 30 residents in it, 3 test positive for COVID, you've in that 7-day period, you've met the criteria to report that outbreak to us. So you've had three residents out of 30, which makes it meeting that minimum number and that 10% threshold for reporting. The remainder of the criteria here listed, so for gastrointestinal illnesses and other criteria for reporting us do remain the same. As a reminder, you're welcome to reach out to us at any time, even if this criteria is not met. If you have questions about whether the criteria is met, we can help walk through that. If you have any concerns or questions regarding just the management of the cases in your facility, even if that reporting threshold is not met, we will certainly kind of provide that guidance, kind of walk through some mitigation strategies. All it'll mean if you do not meet that threshold is that we will not do ongoing monitoring for that period of time until the outbreak has closed. Any questions about this? I know it's a little bit of a wordy kind of sentence there, but any questions about this criteria for reporting respiratory illnesses to public health? See some typing in the chat. Just getting to here. Yes, we will send a copy of this guidance out in an email following this meeting. And again, if you, as you're kind of reading it, digesting it, do have any questions, you're welcome to reach out and we can kind of walk through what that means. Okay, with that, I will pass it back to Bridget. Thank you.
Yeah, and thank you so much, Tyler. It's very timely and important, and yeah, I'll make sure to send that out right after this meeting, along with the presentations as well. I wanted to launch one more poll while we're transitioning to the presentation. This one's pretty brief, just a yes or no. We're interested in knowing about whether or not continuing education credits are something that you'd like to be earning while you're attending these sessions. So please do submit. It's anonymous, as we said. And Jonathan, I'll let you pull up your presentation while folks are doing that, and we can get started.
Perfect, thank you. There we go. So we're going to have a little chat about something that's probably that you folks are probably way too familiar with already, gastrointestinal illness. illnesses. All right, yes. So gastrointestinal illness can be caused by many types of bugs. It could be a virus, bacteria, parasite. Transmission is usually fecal oral, but some are hardy enough to be able to transmit via fomites or objects, such as frequently touched surfaces, counters, doorknobs, and restrooms. You may hear complaints from individuals about food poisoning, stomach flu, stomach bug, or notice people repeatedly visiting the bathroom in a short amount of time. In terms of the fecal oral route, there are several barriers that help protect us from transmission. Toilet, sewage, functional sewage helps a lot with protecting our water, food supply, and preventing access to preventing flies from gaining access to contaminated feces and other insects. Hands are still a route that's able to avoid the toilet. That's why hand washing is so important, especially if you're caring for other people, helping them with food, or handling food at a group event like a potluck, or if food's being catered. Sorry. There we go. Disease transmission in relation to enterics in long-term care facilities is extremely complicated because of in part because of the population that you're working with on a daily basis. They're at risk for complications. They may not be able to resist infection as well as younger folks. They may have health conditions that make it extremely challenging to identify when someone's sick with a GI illness, because loose runny stools or diarrhea may be something that is their normal. A lot of long-term care facilities and assisted living setups are typically going to include several to many people living in the same building. A lot of opportunities to transmit something that someone may be infected with, especially if they're shared dining areas, social activities. As people interact more with other people, there's more opportunity for transmission. There's also the twist of these folks are going to be visiting healthcare settings more frequently than the general population. When people visit healthcare settings, there's an opportunity to pick up some sort of pathogen during that visit. And all of these and more reasons are why a proper response and mitigation measures are so important in reducing the spread of these outbreaks and illnesses in long-term care facility settings. Going to go into the different types of enteric pathogens that can cause GI illness. This is a list of just a few. And today we're going to focus in on a bit more common bugs that we see in Oregon. Starting with CRE, or carbapenem-resistant enterobacterales. They are a bacteria. They transmit person to person from dirty hands, wounds, or stool. And they can also be transmitted by contaminated medical equipment. So this is something that folks may pick up after surgery or visiting a healthcare setting where an invasive procedure is done. Signs and symptoms are typically pneumonia, bloodstream infections, UTIs, wound infections, and meningitis. The people who are most at risk of contracting CRE are folks who stay in a healthcare setting for an extended period of time or even visit. They are unfortunately resistant to most antibiotics, and treatment's going to be personalized by the provider that is supporting the individual who's infected. That they're going to run lab tests to see what antibiotics and work best. Sorry, my progress. Just to get a look in terms of cases in Oregon, this is something that we see throughout the year, something that you'll see across multiple enteric pathogens is there is usually a bit of a peak in the summer months. So between June and August, we'll typically see an increase. C. diff is another pathogen. The transmission is typically person to person, but it can also be transmitted via spores. So contaminated surfaces, contaminated food items, feces, if it's not disposed of properly, can all potentially result in transmission. Signs and symptoms are going to be very similar to the other GI illnesses with diarrhea and fever, but it's also going to come with some stomach tenderness along with the nausea. Folks who are 65 plus and have recently stayed at a hospital or a nursing home are going to be your most at risk. Folks with weakened immune systems or a previous infection with Clostridium difficile are going to be also at risk for infection and complication. It can result in dehydration, extreme cases resulting in inflammation of the GI tract and what's called toxic megacolon, sepsis, and can unfortunately result in death. Interestingly, there is a lot of quite a bit of good research on how the gut microbiome impacts a person's susceptibility to C. diff infection. So an improved gut microbiome, which is influenced by good nutrition and diet, protects people from infection and reinfection. This is one of those critters that does like to hang around. It finds places where it can reinfect people, including people's bodies, different areas of their body. So help assisting them with bathing can be very helpful, especially if a resident's infected. When a resident is a case, staff, as is should be the precaution for any of these enteric pathogens, is to wash their hands before and after interacting with residents, use gown and gloves, and provide these residents who you know are infected with these conditions, especially C. diff, their own separate bathroom. So there isn't that opportunity for transmission to occur between residents. E. coli is another common critter that is a bacteria, likes to infect people via the fecal-oral route. It is very often transmitted by food, which can be contaminated at any point during cultivation, transport, and meal preparation. Typically results in diarrhea, UTIs, can result in pneumonia as well as sepsis. Risk factors are if person's under 5 years old, 65 years or older. Typically people will recover with supportive care, and if they need antibiotics, getting that treatment does help with outcomes. There are sugar toxin producing E. coli that can result in HUS, which can cause kidney failure, permanent health problems, potentially death. Usually it's something that we're really concerned about for kiddos, but if anyone has any kind of pre-existing kidney health condition, they could be at risk. Best method for prevention, washing your hands. Soap and water is what needs to be used. Hand sanitizers, unfortunately, will not do the trick. Also very important to separate your foods when you're storing them and when you're preparing them. So use different utensils for preparing your raw meats. Use separate cutting boards when using meats and preparing veggies. Also make sure your cooking is adequate, and refrigerate your foods within 2 hours. 2 hours is the very high limit. With these warmer months coming up, with all these group gatherings, I'd try to refrigerate food within 30 minutes to an hour, just because of the change in temperature. Looking at cases, we do see that kind of trend upwards during the summer months, peaking in August and coming back down. Norovirus is a very, very, very common bug. Very hardy virus, very difficult to eliminate from an environment. Fecal oral is the preferred route of transmission. The signs and symptoms are very, very rapid onset of typically both vomiting and diarrhea, or at least one. And when I say rapid, I mean within 12 to 36 hours, someone's going to be very, very sick, visibly sick. Fortunately, only for a day or two. Most people recover after 2 days. There is no specific treatment. Rehydration, rest, those are the two big factors in helping people recover. It is a very, unfortunately, common cause of outbreaks, not only for long-term care facilities, but other facilities that we at the county support, and is a very common cause of missed work for people, maybe out for a day or two, because they need to visit the bathroom so frequently. Prevention is about cleaning the environment, or very focused on cleaning the environment in terms of preventing norovirus. For hard surfaces, there are EPA approved cleaners and also substances that you can formulate or put together at your facility. Carpets and upholstery can be cleaned using a steam cleaner, but you want to use the EPA approved cleaners on those frequently used surfaces, such as chair handles, doorknobs, door handles, counters, bathrooms, TV remotes as well. Salmonella is another bacteria, very common, treated, can look very similar to all the other GI illnesses, with the nausea and vomiting. The age group, though, people even 50 to 64, they can be at elevated risk for adverse health outcomes related to salmonella, whereas E. coli, we were looking at the 65 plus age range. It's the people who are 50 to 64 with underlying medical conditions that weaken the immune system that are particularly at risk. Salmonella is a leading cause of foodborne illness, hospitalizations, and deaths across the country. It's implicated in, or it usually transmits via multi-state outbreaks involving different food items such as chicken or leafy greens, other veggies. It is more common in the summer, as is the case with other enterics. In prevention, the CDC advises provides the same advice in terms of preventing E. coli and other enterics. Make sure you wash your hands with water and soap. You don't cross-contaminate, and use separate cutting boards and knives for different types of food items like meats and veggies. Salmonella cases in Oregon going back to 2024, we see a steady increase up through the summer, and last year even up into the fall, and then we see that decrease in the winter months. Shigella is another bacteria, loves to get you through that fecal oral route, and it doesn't take a lot. It takes a very, very, very small amount of the virus or contaminated substance to infect another person, and it can infect other people through food, hands, and water. The hallmark symptoms are going to be diarrhea that can be bloody and prolonged, or that can last for 3 or more days. Can also result in fever and stomach pain and feeling the need to pass stool even when there's nothing to pass. The most at-risk folks are going to be folks under 5 years of age, travelers, and those who are sexually active. It can be transmitted by oral anal sex. But folks will usually recover within 5 to 7 days with a lot of water. It can linger for a little while. There is currently an outbreak in the state that has been going on since about May of last year, and that's resulted in this kind of ongoing increase in cases. instead of just like a decrease in the winter, we're seeing a steady increase because of this ongoing Shigella sonii outbreak. Sorry, my machine is not cooperating. 1 second. And just to review the different steps for prevention and control, just some of them, hand hygiene is going to be one of the most important aspects of prevention that we can emphasize amongst residents and staff and have a huge impact in terms of cutting down on the ability for these bacteria, viruses to transmit and hang around and cause illness. Always hand wash with water and soap when you suspect any kind of GI illness. The hand sanitizer is not going to be effective for norovirus, and it can be hard to tell the difference between norovirus and other GI illnesses, especially at the beginning of an outbreak. Signage is also very helpful to help remind people, including guests and family of residents, to wash their hands. Having PPE available for staff and also for guests if you know the resident is ill, but you're still allowing visitors, giving them some protection to be able to disrupt transmission can be helpful. Information is also one of the most powerful tools in preventing transmission. You can inform residents, staff, and guests through emails, make it an agenda item for a group meeting so everyone at your facility is on the same page in terms of what's circulating at your facility, what steps people need to take to protect themselves and the residents, and signage for those guests as well as employees and residents. Also make sure that all guidance is being followed and all standards are being met in terms of handling bodily fluids, especially spills or accidents that may happen in public places that are frequented by both guests, residents, staff. Make sure that if there is a spill in a dining area, entryway, hallway, bathroom, that it's cleaned properly and properly sanitize contaminated equipment or dispose of it if need be. Hand hygiene is something that can be easy to kind of forget how important it is, especially when the day is really busy. Make sure that you at least get 20 seconds in when washing your hands. Get all the surfaces you can, including the back, in between the fingers and the fingernails. Again, don't use hand sanitizer, please, during a GI outbreak or suspected GI outbreak. Don't use it, and it's best in general when preparing food to wash your hands with water and soap, especially when after handling any type of bodily fluids like feces or vomit. Oh, and also wash your hands even if gloves are being used. Gloves don't take away the benefit that comes from washing your hands. It's like an additive. Wash your hands and wear the gloves. It's better than just wearing the gloves or just washing your hands. Especially important to wash before and after all of these different activities listed, especially with interacting with residents, preparing foods, a big activity where really easy to contaminate some food during preparation or delivery to a resident. Here's a link, EPA guidelines for appropriate disinfectants. A lot of these disinfectants do require contact time, so be mindful of keeping the space clear while the disinfectant is disinfecting. Make sure residents are aware to not walk through that space, and yeah, make sure the disinfectant has the opportunity to do what it needs to do. The steps that you folks take when you identify a potential outbreak, when you see people start to get sick with a GI illness, is to keep track of who is sick, who's at risk of being sick, which staff have been working around individuals who are sick on which days. Really, the line list captures a lot of this information, but please let us know if there's any adjustments to the line list and we can make to better capture this kind of information. When you do suspect a case, make sure that you isolate the sick residents as well. Send folks out to see a provider, get evaluated by a healthcare provider when it's necessary. Contact us at the health department. Let us know when you're concerned about a potential cluster of GI cases or an outbreak, or if you have any questions. Please use any of the staff emails that we have included in this invite. We also have contact emails in this presentation. Make sure that all the cleaning instructions are followed for any of the disinfectants that you use. The EPA will have pretty clear guidelines on there, but if you have any questions, that's something that you're also welcome to reach back out to us to make sure that what you're reading is what is written. Make sure that you dispose of the contaminated materials and monitor and keep track of any of the cases, any of the people who are ill, to see when those symptoms resolve, confirm they're doing better, and do what you can to track their social activities. And again, keep track of all the residents and staff. Keep track of the sick residents and staff, including what kind of symptoms they have, if that's possible to gather, and also if there is capacity, when people start to recover, how long people are ill gives us a good idea of what kind of pathogen it could be, especially if getting tested, coordinating testing is challenging during a given time of the year. We could be relying on the different features of the illnesses and those types of details to figure out what kind of pathogen it could be and what kind of steps we need to take. Again, Washington County Public Health, we're always here to respond to any questions you have. You can call, you can email. There's a general email that I have here at the end. But and phone number, but again, you can also use the employee emails that we have. I think that's, I did include some pieces on access to care. If a resident does need to be assessed by a medical provider because of their illness, if they're having severe vomiting, diarrhea, if it's been lingering for quite a while, or you notice they're beginning to be dehydrated, or any other concerns that you folks have, please make sure they have the ability to visit a primary care provider or clinic first. If folks are unable to contact a primary care provider or clinic, then the following option is urgent care. And if primary care isn't available, urgent care isn't available, then the ER is still there for you. Certainly, if the illness is severe enough and you have that concern, you can skip right to the ED. But if you are identifying illness and it's not severe to the point that you're like, I need to take them to the ED now or the hospital now, this order can be helpful. And we do in Washington County have some federally qualified health centers that can connect folks with culturally and linguistically appropriate primary care. Virginia Garcia Memorial Health Center and Neighborhood Health Center also work a lot with different community-based organizations from many different that specialize or focus on supporting many different cultures and communities in Washington County. So if there is a resident with that speaks a language other than English, and they want to be able to connect with other people who speak that language, these folks might be able to help connect you with the folks that can help build that community for them. And yeah, last page, again, phone number, email, to contact our team if you have any questions, suggestions, concerns, please don't hesitate to contact us. A lot of the information that I pulled are from interactive websites, and I included those links at the bottom of the slides. If you have any questions in relation to these websites or dashboards, you're welcome to reach out to me, and we can discuss if you're having a hard time accessing something or trying to look at data in a certain way. I'm happy to take a beat, and we can talk through how we can use these tools to help you kind of explore what you want to look into. Any questions or comments on any of the pathogens or precautions that I ran through? Great. Well, Bridget, I'll pass it back to you.
Okay, thank you. That was a great presentation. Appreciate your time in putting that together for us. And as Jonathan said, you will have that information in those links. I'll make sure to send out the slides after this meeting, along with the guidance that Tyler shared. I do want to give a little plug for our partners at the Oregon Health Authority. They do a monthly meeting. It's called the Western Oregon Infection Prevention Collaborative. So they share a lot of good information. So I'm putting that link in the chat to sign up for that mailing list so you get those notifications. I'll also put that in the follow-up communication from our meeting today. And just want to pause, is there any other things that staff want to mention before we wrap up or share? I'll leave space. Okay, Tyler?
Yeah, sure. Just one thing I forgot to mention on my piece. We actually did recently just update our email address for reporting. So it is just now cd@washingtoncounty.or.gov. We will send that out with the email as well. If emails go to our old email address, which was like HHS_public health, something like that, it's not a huge issue. It will get routed to us for a period of time. But if you are needing to reach out to us, good would be a good idea to kind of shift to moving that other email address if you can.
Good.
And again, we'll put that in the email as well.
Yeah, great. Thanks, Tyler. Okay, wonderful. So if there aren't any other further questions, we're happy you joined us today. Look for that email. As I said, we have been recording, and so the recording will be sent out as soon as it's housed on our website. So that's likely next week sometime. So that'll come in a separate email from the meeting follow-up today. And thank you all for joining us. Bye-bye.